Hola medicos, in this video we are going to speak about the treatment of ethanol poisoning. Ethanol is commonly known as alcohol. You guys might have known better than me. So ethanol is a respiratory and CNS depressant, respiratory system and CNS depressant. Actually speaking, it is CNS stimulant commonly, but selective depressant. Depressant. Okay. So when does the alcohol become fatal? When you consume around 150 to 200 ml of absolute alcohol, that is 95% weight by volume, that is 95% concentrated alcohol around 200 ml, that too within 1 hour, then it becomes the fatal dose. Okay, and the fatal period is 12 to 24 hours. This is the fatal period after consuming the fatal dose. Okay, and so what's the treatment? We'll go straight forward without any explanation. This should be done. Okay, you should ask the history of the patient and you should examine how is the patient. So you will get to know the orientation, consciousness of the patient, consciousness of the patient. So it is mandatory to do GP so that you will get to know how the patient is. So straight into the point. You should start injection 25% of the dextrose, that is glucose, in and for 4 ampoules. Then you should give multivitamin injection, that too in 10% dextrose drip. Okay. And the alcoholics have thiamine deficiency. You should not forget adding thiamine. And injection mannitol, that is 300 ml IV drip. Okay. So after that you should go for blood alcohol concentration if you want, and it will be when patient goes around 400 mg per dl. At that time it becomes the concentration becomes so much that the patient might end up in coma, and you should check for renal function tests so that to decide whether to go for hemodialysis or not. So this is treatment of ethanol poisoning in a nutshell. So this is very simple. You will give 25% of the dextrose, then 10% of dextrose with the MUI, then mannitol. That's it. Only 3 points you should remember to get the patient back. But actually it depends on the patient's condition. So it varies from patients to patients.